Hello, ma'am. Welcome to
Hi.
Southwest.
Hi.
A lot of people these days are scared of, on one hand, you have people coming into dermatologists for different kinds of procedures, cosmetic procedures, but there is that fear as well in many people.
Yes.
Why is that fear actually building up on cosmetic procedures? What's actually happening there?
Okay. Like it's true that when they come to us for the first time, they always has a fear like this is going to cause a lot of side effects because always that fear was there when you go to a doctor. Doctor is going to
Yeah.
do some procedures. It can cause side effect, and there is lot of publicity on like some celebrity had done this procedure and this happened, and especially the old age people will be telling if you do something it will damage your skin, it will age it more, and that fear is already there.
Right.
And when they come for the first time, they're not sure like what we'll be advising, whether it will be painful. So many factors are there. So what I do is in my first consultation, I do a lot of hand holding. I advise them, like if they are not doing any skincare, first that's the first step. Skincare and general health maintenance, diet, everything that we advise in the first thing, because procedures are not the first thing.
Yeah.
They need to start their journey like in a like holistic way. First, what is required is proper skincare, proper sleep, diet, everything should be balanced. And I like depending on the age, depending on the skin type, whether they actually need something. And sometimes they start with some mild medifacial or something, so they are more comfortable. They're used to facial, so these are like medicated ones. So the serums go inside, so they see the improvement in skin quality, and they are like initially otherwise they say, oh, no, I don't want any injections. Even if it's a skin booster, they may be scared. So sometimes I make them comfortable and start with something gentle like this, or some skin tightening, mild treatments, and they feel confident. They feel they're looking better. Somebody is giving them compliments saying that you're looking better. And then at that stage we progress into more procedures.
Okay. Ma'am, when you look at, there are beauty parlors and then there are dermatologists. So normally when people go to a beauty parlor, they're okay with different kinds of facials, some
Yes, yes.
gold facial, oxygen hydra
yes.
facial, so many facials are there. They're okay with experimenting
Yes,
on the
yes.
most expensive one, most complicated looking one,
Yeah.
hearing one. But when you go to a dermatologist and when they suggest something like a facial or something similar to a facial or whatever you call it,
Yes.
then they get very panicky about it. So how do you differentiate, and are facials and beauty parlors actually safe?
Actually, what people think is that is natural product and this is medical. They always think that whatever is done in a parlor, it is fruit facial or vegetable, it's something. So it's not going to harm them in any way. All natural thing. They are used to going to salons and doing multiple procedures. But when they come to a like dermatologist, they feel these are medicines. If like even if we talk about chemical peel, they think it's a chemical, so it's going to harm. That's the feel they have, that actually this chemical means it is a medicine.
Okay.
Even if in fruits there is some active compound, and these peels, they are extracted from various fruits like apples or sugarcane. It is extracted from these natural ingredients only, but it is named chemical because it is an active ingredient.
Okay.
But it is actually safe, and depending on the skin type will be doing, but they'll have a false like feel like, so it's a medicine is being applied, it's a medical treatment. So that's why that fear comes. But what I feel is most of the young generation, they know about these things. There are like, so they feel it is better, always better coming to a dermatologist rather than going to a salon or doing some procedures. And because that person may not be knowing the well versed with what is actually required, so they trust us more. But maybe in their 30s and 40s, some people when they come, they haven't done any of this. I feel they have a little more apprehension in starting up in the procedures.
Right. Ma'am, social media these days are, if you open Instagram, any place you go, you have so many viral trends, and the more number of followers the person who is saying this has, then the people tend to believe that it is real and they follow those things. How do you then actually tell them not to do these things? Like how, especially your own clients when they come to you, how do you actually tell them that that is not safe and go in for safer procedures?
Because what we see is there are a lot of like in social media, there are a lot of ads for the skin whitening. That's the most dangerous thing what I feel. because they give ads before after. This will happen after you use cream. Many of these creams are not approved. They don't even have a manufacturing license. They are sold online, and they're like they're creating like big hype with these creams. So what they're mentioning is, if you use this cream, within 1 week, 2 weeks, you're going to become fair, and they're like easily available. You just order this and you get it.
Right.
So that is the biggest danger what the social media is causing. So all these youngsters start using these creams, and some celebrity, somebody will be promoting it,
Right.
not knowing what is inside the cream. So all these and some other home remedies which they see and they experiment on their face, and what we feel is like none of this is going to help them. Finally, they come with damaged skin or sensitive skin after trying so many things, and once they start using these creams, they become addicted to it. Then they suffer from skin damage. Then there is psychological damage, because initially they were fair, then again their skin is getting irritated and getting darker when they are going out. So when you're looking for the shortcuts, always you need to pay a price for it. Looking for the shortcuts. There is no shortcut for looking good, glowing skin and all. You need to follow a routine. You need to do so many things. You can't overnight. You can't become like bright, beautiful and glowing. Like you need to improve your skin quality.
Right.
You need to eat properly. Everything need to be proper if the results are need to be maintained. So you can't look for the short-term goals. So what these people will be advertising or somebody is promoting is some short-term things. Or you do this injection, you'll do this. It won't be done by a trained personnel.
Right.
It may be done by not even a medical or like some other untrained person may be doing these procedures, but they're not aware. When they go there, they see some doctor. They get even the injections done. They don't even ask who the doctor is, what is being done, because another celebrity would have gone there and got it done, and they're endorsing, and you'll get it for a discount.
Yeah, correct.
They're like selling, this thing. They're saying we'll give it for a discount, but actually comparing the actual price, it may be even more than that.
Yeah.
But when people say it's a discount, they feel, oh, I'm getting it for less.
For less.
So what you should think is, what am I worth actually? Should I use something cheap on myself, experimenting, only because it's got cheap, especially if when you're doing some injections on a face or hair or somewhere. So you need to think what it is going inside my body. So we need to make sure we are using the purest
I
thing,
think
the
in
best thing.
Kerala it was a big issue. People used fairness creams and it
Yes,
actually
yes.
damaged their kidneys also, because the high
Yes,
level of
yes.
mercury was found
Yes,
in
yes.
those creams. It's not just the face which is going bad, but their entire system, right?
Yeah, we know like even whatever we buy, when we buy some dress or like we know that when we pay a price, we know why we are paying for it. But people think whatever procedure you're doing, it's all the same price, and the other person is offering this. It's not. The quality really matters. The like raw materials or whatever like products we are using, the quality really matters. What we are using.
Right.
So when somebody sees and you get a discount, means immediately going there and finally you don't get any result and you get any side effect, then you have to spend more money for that.
Right. In your daily practice, is there any particular cream or any particular kind of treatment or anything of that sort, home remedy that they have tried, anything that you commonly see that has actually damaged the skin more? Any particular thing that is actually causing more harm to them?
What I had seen is some people who follow a regular aggressive skincare routine that I had seen. They follow like AHA, BHA, then they use a retinol and so many products, skin layering and all. They must be having good skin initially. When they try this layering, some Korean model showing something, they think of getting this glass skin, and immediately it was normal skin, then it turned to sensitive skin. So we see many of the youngsters, even in their like teens, they'll be starting using these products. So and what they try to buy is the cheapest one that is available for them. And now it's found that even in lipsticks, like there are a lot of heavy metals are there. The cheap ones, you get a lot of heavy ones. So you are applying it regularly and you are ingesting it inside with the food. So
can you give a message to the teens, especially who are, this makeup in young has also become, it's caught up on Instagram suddenly. Like, of course they were expecting Korean skin and glassy skin and all that. But then, the makeup part of it has got into the young very early now. So could you please, tell the young what not to do and why it's dangerous?
Yeah, actually, even at our times, we never use makeup during the tea. Now it's like very common practice, like you are using a lot of makeup even in your school days. So actually, we are applying all these chemicals. We don't even this kajal, lipstick. There are a lot of heavy metals and chemicals, and you're using it regularly, and it will be getting absorbed into your skin, and you'll get darker lips. Many of the teenagers, they have dark lips, but they're using this liquid lipstick. Long time they're using, every day they need to go out with the lipsticks. So what happens is invariably they'll get skin damage. They can't go out without makeup because the skin doesn't look fresh or glowy, so they have to use a makeup. But actually at your teens is the time when your skin needs to glow, because you're healthy and you're young, and it needs to show that the skin is actually glowing. And even at our times we didn't have anything,
Right.
so several years back there was nothing, but the skin was okay. But now basically because of the lifestyle changes, its skin doesn't have that glow. It is patchy, it's pigmented, and the stress factors and the lot of the temperature changes, heat, everything is damaging the skin. And what they're doing is they're covering it with makeup. Even they get a little dark lip, then again they're using the makeup to cover the lips. So they're all, instead of that, they should focus on having a good skin health. They should focus on the quality of their skin, improving the skin quality, so they don't need that makeup.
Can you give them a daily routine kind of thing which they can follow for a good skin health, or even food that they can eat? What is a daily good routine for a skin health in young?
In their teens, actually what they need is prevention. Their skin is good. They need to protect their skin. They need to prevent from damage. So you need to use a mild cleanser for washing your face. And it depends on your skin type, whether it's too oily or if it is very dry or sensitive, it's normal. You need to choose a cleanser accordingly. You can cleanse your face in the morning and night. And if you are having acne and still it's little dry, you can use two types of cleansers also. One in the morning with the mild, and evening you can use a salicylic based some cleansers they can use, depend on the skin type. And they have to use a moisturizer. Like that also depends on the skin type. If it is more oily, you have oil control moisturizers. Or if it is sensitive skin, you have barrier repair moisturizers. So these are, and this has to be, you can use it twice daily, or if it's like little normal or oily, maybe once daily. And you have to definitely use a sunscreen. And the sunscreen also depends on your skin type. And if you are getting too much exposure to the sun, it's always better to use a tinted sunscreen, which gives more lasting protection. Or if you have acne prone skin, you can use a mild gel sunscreen. So basically these are the three things which you need to start using. And serums may be a little more later. If you are in your teens, basically these three things you can start.
Okay.
And if you are having some acne or some other skin problem, you can use the actives under doctor supervision, like whatever they're prescribing, you can use it. And one thing which you need to be careful is don't change your products too often. If you're comfortable with one product and your skin is okay and you're getting a good result, don't go on changing, like you're changing your dress every month. You buy another face, or you buy another sunscreen, or your friend is using another one, you use that. So frequent change of product is not good. If it is something is good for you, just stick on to that.
Okay.
And after some time, when the climate changes or the skin type, it can change. Sometimes with the hormonal variation and all, the skin type can change. And in that case, you may have to change your skincare product. So it's always better to do it under a dermatologist supervision, so they can suggest you what's the best thing for you. And they can even give you some serums like niacinamide or something if you are having a little acne, open pores. But it's always better to use a prescription product rather than going for online, because you have so many choices. Somebody is suggesting, you use this product. Actually, you don't know.
Correct.
What is inside the bottle also, we don't know.
Right.
So it's under your responsibility, you're buying something.
Right.
That's what I feel. It's always better to start slow. And always you can use a lip balm with an SPF.
Okay.
And if you want, instead of a lipstick, you can use a little maybe tinted lip balms also initially. And lipsticks occasionally, not every day using the lipstick. I think it's suggested because invariably the lips will get dark and dry,
Okay.
and you'll have to take treatment. And we don't know the content of the chemicals that is going inside.
Right.
Even the sunscreen, you need to use the safe product. There are some sunscreen which are maybe having some ingredients which may not be safe for long term use, like chemical ingredients. So even sunscreen, teens, if you're okay, you can use the mineral sunscreens, so it's not getting absorbed.
Any product that they're buying, if not recommended by a dermatologist, first of all, they should probably not use it. But
Yes.
if somebody is looking for a product, if they're trying to use it, is there any word that they need to look at in the ingredients that is a no for them?
What they need to check is like the teens, you need to check whether it is non-comedogenic, whether it is like paraben free. All these things are better, like use, because if they're acne prone, if that comedogenic means you can get comedone, blackheads, whiteheads.
Okay.
So always better to use the non-comedogenic products,
Okay.
and which are free of much of preservatives, and fragrance free is always better. Don't look for the scented, too much scented products. Always look for the fragrance free products, and don't start like using AHA, BHA, retinol, everything at the teens.
Okay.
Because there's a certain age when you can start it.
Right.
And the thing is that you'll use it and you'll go out in the sun and you'll get more skin damage.
Mm-hmm. So when a lot of people are confused whether they should use a soap on the face or a face wash, what is the thing which you would suggest?
Actually, the normal soap, what we get is of alkaline pH. So when you use the soaps regularly, it can dry out the skin.
Okay.
So what to suggest, either you can use a soap in the skin pH, that's called a syndet bar. It's called synthetic detergent. It's not actually a soap. It looks like a soap, but it's actually a syndet. You can use a syndet bar, or you can use like a cleanser or a face wash. Using a face wash or cleanser is better because it is more pH balanced. It's more gentle on your skin. The normal alkaline soaps, long-term use, it can cause like barrier damage to your skin.
Which 3 DIY at home? They do a lot of things at home these days. Which 3 actually scares you when they come to you saying that I do this at home? Like
One thing is they're using a lot of scrubs. That is, I don't advise. They use coffee scrub, sugar, all these things. Like they like to do it, sometimes on a regular basis. What happens is they have like micro injuries on your skin because they are having the irregular borders, these scrub particles. So what happens is it can damage the skin barrier. So like using the scrubs regularly is a big no.
What about turmeric? A lot of people do use turmeric and basin. Those things.
Basin is not like if they're having a too much oily skin. Sometimes they wash their face with basin. But if your skin is dry, then it may be a problem because it like removes more oil. But once in a while, if you're using like washing with basin and all, it's okay. But using too much of this things like milk on your face, sometimes it can trigger acne. And oiling and massaging your face, that can also, some people use different oil like almond oil and different kinds of oil on your face. So that can sometimes trigger acne.
Okay.
So better not keep away from too much, oil application, massaging, scrubbing, all, and too many fruits. They use too many fruits, papaya, all these having some enzymes. So some people develop some allergic reaction.
Okay.
And there are some people who use even toothpaste on the acne. It's a big no. They feel that when you apply the toothpaste and there some have that pigmentation around the mouth, then they use the toothpaste and they get an irritant reaction.
My last question to you, if you can give one message to those who are actually struggling with acne, the youngers, the teenagers who are struggling with acne, one message to them on what you would say.
Okay. Acne is something which is not due to the causes which happen on your skin. It can be due to internal factors and external factors. And acne is something that you shouldn't feel too much stressed about. Like what happens is when you get too much, one or two acne itself, they started getting too much stressed about this acne because some other your friends pointed it out. So once you get stressed, you'll get more acne. Acne is something which can be easily treated. It can be controlled, and now we have a lot of like even medication to remove even the scars. Like you can get back your normal skin. Only thing, you at the earliest stage you take a proper treatment. Don't wait for years. Many of them come after 2 years, 3 years, after trying everything at home. Then they try what is available internet, what the social media says. They try all these. Then finally, I have many clients who are coming after 4 or 5 years. And I ask them why you are coming now. Maybe my marriage is after 3 months, 4 months. I tried everything, but it's not working. They haven't consulted a single doctor for 3-4 years. So what is important is the first sign of acne. You shouldn't ignore it, because acne is actually a long-term problem. It may not be, after 1 or 2 years, you can't expect that it will go. Even if it goes, it leaves scars.
Right.
So it's our phase. So you need always to prevent from the scarring from occurring. Because even if the acne goes and the skin is normal, it's okay. But when the scar develops, we need to do laser, we need to do multiple procedures to get your skin back. So the best thing is, when you're having little acne coming up in your teens, you consult your dermatologist, so they'll give you proper advice, and along with that, the proper skin care, only what is required. And if you're following a proper diet, there are certain foods you need to avoid, too much of this high carb diet and too much sugar, milk, everything, you may have to cut down on those things. Stress management, sleep, this is all very important, because all these internal factors can also trigger acne. And sometimes you may be having some hormonal issues. It's common in the teens, puberty. You'll have some hormonal issues that can trigger acne. That only with investigation we can find it out. You can't just ignore it saying that, oh, this is teenage problem, it's okay.
So are there any tests that actually they can do?
Yes, we do some blood tests. But I am a person who evaluate, because I had found many of them are having hormonal imbalance. So if they ignore them at all these things, and few months they are going on, and then they don't get a response, and then I'm testing, that much time is gone.
Right.
So what I do is I do the evaluation. So at initial stage itself, I can find out what advice I should give to a person, because even the dietary advice will depend on those blood tests. What issues they
are
having.
they normal blood tests, or are they expensive?
Normal and not very expensive. It's that you don't have to repeat it very often. The hormonal test channel we may do. So we can give a proper advice regarding the diet, everything, the skin care. So when you're starting in that way. You have the skin care, you have the products, and then you have the dietary advice, any supplements.
A holistic kind of
holistic
approach.
Yes. Yeah. And what I do is I always start with the supplements. I'm not a person who uses too much antibiotics or the medicine, because the gut is also very important, maintaining the gut health.
Right.
So for that we need to balance the supplements can help with them. So they don't have to worry they don't have to feel that if I go to a dermatologist, she's going to give me a lot of medicines and then I get side effect. It's safer to treat with some online remedy or at home remedy. It's safe. Other side effects, but it's the opposite.
Right.
Like we are concerned about their health. So we'll make sure that we are not causing any harm. What is only required only we'll give, because initial stage is very easy. You can give topicals only, or you can give a mild supplements, your skincare products, and it's easy to control. And we can also monitor whether there is, because some individual they have a scarring tendency. For some it's not there. So when we detect it early, the scarring tendency, we'll see whether we need to give additional medication so that their acne will go off, so they don't have to suffer for long.
Right.
So it's always the best thing. You can, the first thing when you see the acne or any pigment issue, anything that bothers you, or it is the hair loss, it's starting. If you start early, then everything reverses fast. You don't have to take that stress all on your own.
Thank you very much, Doctor. It was wonderful speaking to you. That is all we have. Thank you.